Health secret is be always happy and help others. That's the secret. As far food is concerned, as you asked, I quit my breakfast the age I touched 40. I take some fruits, some vegetables, that's all in the morning. I quit dinner after the age of 50. Night I may take a cup of milk, one banana, that's more than enough for me.
Hmm.
For lunch, I take about 1 or 2 teaspoon of rice. 1 or 2 teaspoon of rice.
Okay.
More vegetables,
Hmm.
more salads. That is the style of my food that I take. And every day I go for walking not less than 1 hour.
Oh, great. Again, one more question. Is there any exercises or yoga kind
That's
of
what
thing?
I'm telling. I go for walking 1 hour and do yoga for 1.5 hours. So 2.5 hours is my schedule in my yoga center. I got a yoga center
Wow, great.
where I teach yoga to the people who are suffering from ailments, therapeutic yoga. And I practice yoga. From my home, I start working at 6:30.
When your day will starts, like when?
No, I get up at 5:30 in the morning. It takes 1 hour for me to have all my cleansing, neti, jalaneti, shotaneti, and then all practices I do in the morning. It takes about 1 hour. 5:30 I get up. 6:30 I start my walking. 7 o'clock I go to my hospital. It's walkable distance. There I got a yoga center in my hospital, Anbu Hospital. We
Yoga.
do yoga. Whoever comes for learning yoga, I teach them yoga and I do.
Okay.
Then I start from there at 8:30. 9 o'clock I come home. So 9 o'clock my work starts for my manufacturing unit.
Oh, great. Again, yeah.
Up to
It's again
11,
medicine.
yeah, up to 11 I will be with the manufacturing unit because it's a big unit. I got one Siddha Yoga Pharma medicine, Siddha medicine manufacturing company, and another dietary supplement manufacturing company,
Wow.
Energy Foods, 2 companies.
Okay.
So I do it. 11 o'clock I come to my hospital to attend my patients.
Wow, great.
So I get patients all over the world.
Wow.
Yeah, I get patients from Australia, America, England, Germany, Italy.
How long you will be in this field? How long?
I am in the field for the past 52 years.
Wow, great, great, great to hear about. Okay.
So
What kind of specialization? Like you handle everything, or you can?
it's a multi-speciality
Multi-special.
because we have got my son, daughter, daughter-in-law, son-in-law all together with me.
Oh.
We combine.
Hmm.
Say suppose somebody comes with a severe piles,
Hmm.
fistula,
Okay.
fissure,
Oh.
unbearable pain he is suffering.
Oh my God.
My son or my daughter will give one small pills or injection to make him forget the pain.
Mhm.
They may write or I may write the Siddha medicines. They get a permanent cure without surgery.
Ah, super, super. What you are expecting is same thing from our
So
side
if
also.
suppose the damage is very bad that it's not reversible, I got an operation theatre. I invested 1.5 crores for the theatre alone.
Ah, great.
So if irreparably damaged, we go conduct surgery also.
It's curable.
Yes, if it is curable, we give with medicine.
Okay.
If not curable,
You can go for the
treat
operation.
operation.
Then
After the operation, you should get it back, is it?
Hmm.
IQ medicine, you will not get it back.
okay, super. All are the without side effects.
Like that, no side effect. All are herbal,
Herbal.
all are prepared by me, and most of the herbs are cultivated in my own herbal farm
Oh, good, good.
by
good.
organic cultivation.
Okay,
Okay,
okay.
so medicines are manufactured in my
One
own
big
company.
question, Dr. G. One big question here I have. A world is facing this kind of problem. Autism. You know the autism.
I am
okay.
the- I-
yeah,
I am-
okay.
I am a specialist in autism.
When you are here, like Dubai Expo, many people, many stall discussing about the autism. Do you have any idea about the cure the autism?
Yeah, I am treating autism patients for the past 35 years.
Wow, good.
I got records. Have you
No, no.
not,
Yeah,
have you not
okay.
seen that?
That's okay, fine.
You-
okay,
you
what,
haven't
what kind of message you are going to give the?
No, autism. What is autism? Autism children are normal in their appearance,
Okay,
normal in eating,
okay,
normal in all other aspects.
okay.
But they're abnormal and unusual only in the brain function.
Oh my God.
If you take MRI of the brain, it is perfectly normal.
Okay,
No structural damage or lesion.
okay.
If you take electrical activity studies, electroencephalography,
Okay.
EEG,
Okay.
it shows no abnormality.
Okay.
But the children show unusual abnormal behavior. What are they?
Okay.
The first behavior, the children will not take initially the first problem of autism children, they will take long time to speak.
Okay.
Normally children start speaking by the age of 2 to 30. Few words, appa, amma,
Yeah.
uncle, daddy, something. But they will not speak.
Okay.
Up to 3 years, 4 years, 5 years they don't speak.
Okay.
I got a herbal preparation,
Okay.
dietary supplement.
Okay.
I assure, if it doesn't work, come on, collect your money with interest.
Great.
Okay?
Okay.
So we give it's a pills and syrup in any form.
Okay.
They take it within a month or two, they start saying few words.
Oh, good. My goodness.
Then after 3 months, 4 months, they start forming sentences with 2 words.
Oh, okay.
Inga va,
Yeah.
anga po,
Okay.
enna pandra. Like
Okay.
that they start asking.
Okay. I'm sorry to interrupt you. Is there any physical exercises or the mental training? Only the medicine you are doing.
Only medicine,
Okay.
but we advise them to go for 5 lines of treatment.
Okay.
What is that? First is herbal dietary supplement.
Okay.
Second is certain special yoga,
Okay.
special asanas.
For them.
For the autism. All the asanas are intended for balancing. Their problem is they are not able to balance themselves.
Exactly.
So we give them balancing asana.
Okay.
Then we give them pranayama,
Okay.
breathing exercise.
Okay.
Why breathing? The mind is under the control of your air, the breath.
Excellent. Excellent.
So the mano maya kosha is controlled by prana maya kosha.
Excellent.
So you regulate the prana to regulate the mind of the children.
Good. Great.
Okay.
Great.
Then the fourth place is the speech therapy. The fifth place is the occupational therapy.
Okay.
All the 5 we combine in our hospital and we successfully treat the patient. For example, if the parent, the autism child can be diagnosed only when the child is 30 months or 36 months old.
Exactly.
Before that, not possible. Many parents, they don't understand it. They have to be educated. They don't understand it.
Okay.
So they leave it. They think that he will speak like that. They allow for 3 years, 4 years life.
Oh my God.
So it becomes much delayed. First problem is speech impairment.
Okay.
The second problem is they don't have eye contact. If I look at your eye, you look at my eye. But there won't be eye
They
contact.
won't observe.
Eye contact.
Okay. Okay.
The third is lack of concentration.
Oh my God. These are the symptoms. What you are.
And not listening to the words. You call. He will be here. You will be calling 100 times, but he will not answer to your call.
Okay.
He will be doing something in his own world.
Okay.
He will be talking himself like that.
Okay.
So the third most important thing is attention deficiency.
Okay.
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 Then the other aspect, some children, they pass motion indiscriminately.
Oh my God.
Urine, they pass urine in the...
They don't identify that thing.
Yeah, anywhere they do it, like animals.
Oh my God.
That becomes alright within 3 months.
Oh.
It stopped completely.
Wow.
They go to toilet, pass motion, wash and come.
Okay. And how much time take to purify this guy?
3 to 4 months.
That's it.
That's all.
At what age it is? At what age?
If the child is brought at the age of 2.5 or 3,
Oh my God. Great.
by completion of 5 years, he can go to regular school.
Oh my God. But these parents are not recognizing the
Yes.
problem.
Suppose they bring very late, we can reduce the symptoms, we can make the child.
Okay. One big question with you, like, how many years up to it's some person is don't know about this autism? Is it past 10 years, 12 years, 15 years? Is it curable again?
No, never use the word cure.
Okay.
Don't say I can cure you,
Okay.
I can treat you.
Okay.
Because in any medical therapy,
Okay.
the treatment is by two-sided.
Okay.
The cooperation of the patient and the
Yes.
doctor
Okay.
and the family.
Okay. Okay. Okay.
Say suppose a child is suffering from autism.
Okay.
The parents are employed elsewhere.
Oh.
They don't attend the child.
Oh my
How
God.
will you expect them to
That's
do?
correct. True. Again, right. Okay. No. My question is yes.
They will leave the child with the servant.
Though it's not
But the
right.
child is longing for the love of the father and the mother.
That is very bad.
So it again affects the mind of the
They're
child.
missing. They're missing the
Yeah, that's
parents'
important.
affection. Yeah.
That's important.
Parents touch like this.
But
Okay.
and
Yeah.
you should follow certain things. You should speak to the child.
Okay.
They don't speak, but they want the child to speak. How will it speak?
Oh my God. Okay.
Two more things I have to complete. Then the other aspect is the autism children show hyperactivity. That is, what is that hyperactivity? It will jump on the sofa, jump down, jump up, jump down. It will go climb on the window.
Oh my God.
You will be there, but they will not be attending to you. They will be doing something.
Oh my God.
And suddenly they will shout, "Ah!" They shout.
Fell down.
Shout.
Oh my God.
They suddenly shout for no reason. Nobody knows why the child shouts. And it will be going on, moving its hand this side, that side, like that. The most important thing is no sociability.
Okay.
It will not move with, mingle with other children.
Alone he can stay.
He will be always alone. He will go to his own corner and he will do his own work something.
Oh my God.
And sometimes the parents take it something good on the side of the something great, because you give 10 toys, the child will arrange the toys beautifully one above the other, all the 10 toys.
Good.
So the parents will think, so how sharp he is, that I cannot do, but he is doing.
He's doing.
But that is one of the symptoms of autism.
Okay.
Because I made a lot of studies on it.
Guru, Dr. Ji, actually people are saying that after 10, after 15, after some time, brain improvement is very less compared to early days. Okay?
You cannot, the reversal is very slow.
Okay.
But still the child will have some improvement.
Okay. You can retreat.
We can make.
Okay.
But if it is early diagnosis,
Early is the better, right?
early is better.
Always below 5,
Yes.
below 5.
Below 5 is fine.
Below 10.
Below 4, below 5.
Okay.
That's good.
It's a good.
About now I have treated.
Above 5 is the difficult too. Yes.
I have treated now 2 patients here in Dubai. Above the age of, one is above the age of 18, the other is above the age of 11.
Yeah, I came to know. Yes, I have seen in this stall. Okay. You're really awesome. Yeah.
So they will certainly see the improvement, no doubt about it.
Okay.
So when there is no drug, in the absence of any medicine, in any system,
Okay.
no proven drug, that's important. People give medicine. Many people give in Ayurveda, Siddha, Unani. So, is there any evidence? Is there any proof? I will show my proof.
Okay. Sure. Okay. What is the reason for the
Beautiful question. In my speech, I present about it. Until date, the etiology is not known.
Okay.
Nobody knows why.
Okay.
There has been a big cry that it's anti-vaccines.
Okay.
The vaccines induce it,
Okay.
but it's not conclusively proven.
Okay.
So you can't blame.
Is there any genetical and other things also?
Yeah, no genetical proof.
Okay.
Because both the parents are normal, the great grandparents are normal,
Okay.
but the child gets.
But is
Not
there
only
any-
that,
is there,
in a family there are 3 children, one gets it, all the other 2 don't get it.
yeah. Okay. Again, yeah. Right. You're right. Or is there any food effect or the
If
parents quarreling?
If food is the cause, the whole family is eating the same food, all children take the same food. Why
Okay.
X gets Y, Z, M does not
Yeah,
get?
you're right. Is there any?
So food is not the reason, environment is not the reason, genetics is not the reason, then what is the reason?
Medicine.
One of the reasons is the mind of the mother during pregnancy.
Super. Well, it should be calm and mental.
When
peace.
the mother has tension, stress, anxiety and depression
Okay.
constantly during pregnancy,
Oh.
negative chemicals are produced from, as a scientist.
Yes.
All the negative chemicals produced by the hypothalamus, produced by the level of dopamine becomes very low.
Yeah.
So the mother suffering from depression, anxiety, neurosis, such women, they produce negative chemicals.
Okay.
So the umbilical cord forms a bridge between the mother and the child. It's supplying not only the blood and oxygen and nutrients,
Feelings.
but it also carries the feelings of the mother.
Super. Well said.
So when the mother is depressed, the child becomes depressed.
Oh.
The negative hormones in the mother starts affecting the formative stage of the brain.
Oh my God.
So what is affected? Not the structure, but the function is.
Okay. Brain improvement is not there completely.
Everything is there,
Okay.
but the function becomes very bad,
Slow.
unusual
Unusual.
and abnormal.
Abnormal. Right.
So they become a big burden, not only to themselves, but also to the family and the society.
Okay. Okay.
There is one more question which has a beautiful answer. Why the number of autism is increasing today?
Yes.
Autism has been known,
No.
but autism in some countries it's very low. In
Guruji,
some countries it is very high.
Dr. Ji, I discussed with the UAE people. What they said is, if you take 100, 30% people are with this autism or disability, born with it. Why? It stalls this also in Dubai. They have most of 30% stall here. They are
Yes.
discussing about this thing,
Yes,
same autism.
but all these words are only words, not in writing. The UAE government's announcement is above 1 in 100. Above 1 in 100, maybe 20, 30, 10, 15.
Right.
It's very
They are
simple
not telling the figure.
They say it is above 1 in 100. Where in Saudi, in Sharjah, in UAE in general, and in Qatar. Why the number of autism is high in this UAE, the Mediterranean country? Why?
Oh, it's a big question.
Why? Because here the children are, even after birth, even during the pregnancy, the children are exposed to lot of mental stress. Because the guy marries 3 girls, 4 girls, and he lives, he spends all his time in only
Wow.
enjoying the woman. So by the time the fellow gets a third wife, the first son is matured enough, he takes care of his third wife.
It's very bad.
So,
Critical problem it's called.
so this leads to a mental stress. So what is the cause for all this? Mind, nobody knows where is the mind.
Yeah.
The science often gives a misunderstanding of the brain, that the brain is a function of the mind is a function of the brain.
Yes.
But for us, it's not just the brain. Mind is the whole body actually.
Sure.
When I prick you with a pin in your toe,
Yeah.
with no time, you transcend absolute time, immediately you get the pain, you feel the pain there.
Yeah.
Is it? That means your brain is not there located, the brain is in the whole body. Your sensation is not something that is only in the skin, in the eye, in the ear, in the nose, in the mouth. Your sensation is the whole body. There is an article in Nature. One boy in United States of America, he was studying as a first-class graduate of BCom course. The usual medical examination, the doctor came to the college.
Okay.
He saw a fellow, he was perfectly normal, and he is a first-class graduate. But he found something unusual, which he cannot say. He said, better you take MRI scan of this child.
Yes.
They made MRI of the brain, they found the brain thickness is only 4.5 millimeter. The thickness of normal brain is 4.5 centimeter.
Centimeter. Yeah, got it.
1/10.
Just 1/10. 1/100.
1/10.
100. 4.5 centimeter means 4.5 into 10 millimeter. 450 millimeter.
Is only
4.5 means 45 millimeters.
Oh, no. Yeah, okay.
45 millimeter,
Okay,
yes. 45 millimeter.
10 times.
No.
Yeah.
Yeah, 45 to 50 millimeter. But the guy has only 4.5 millimeter.
Yeah.
And he writes, the brain appeared like a balloon filled with water, cerebrospinal fluid. But still the guy is normal, healthy, no symptoms. Then what is the topic of that article? Is brain necessary?
Oh. Where it is published?
It is published some 30 years back in the Nature.
Oh, good.
What is written there? Is brain necessary?
Necessary to function.
So now we talk. You have a small clot in the right side of the brain. That's why you have lost your left limbs. You have a small clot in the left side of the brain. Your right arms and limbs are lost. All that you say, where is your theory now? A fellow who has no brain at all is otherwise normal. So, the brain is, of course, controlled by mind. Mind is there. The motor activity of your whole body is directed by the brain. You do agree?
Yes, exactly. Yes.
But mind is not just giving order and taking order.
Signals to
something
the body.
more.
Okay.
As a scientist, you know that the
Yes.
mind is not a traffic constable.
Just not a messenger. Yeah.
He has got many other roles to play.
Yes.
He records everything.
Yes.
And now what our yogis and great saints say, all the informations are loaded in your DNA, loaded in your brain cells. You can trace back all your previous births. If you can go further and deep by contemplation. That is a yogic invention.
Yeah.
But the scientists will not accept it because it cannot be measured by your scales.
Okay.
So you don't agree.
Yes.
For anything and everything, if you go searching for your proof, it is endless.
Yes.
My mother showed some person and said, he is your father, I accepted it.
Yeah, that's it.
That's gone. If I go for DNA study, this and that, the DNA study, what it will say? It will say that so and so is not your father. It cannot say so and so is your father.
Good.
Correct.
Yes.
Then we have to find.
It will say, it will give only negative affirmation. It will say that so and so is not your father. Can it say so and so is my father? No. That is the limitation of science.
Okay.
With that limitation, you start climbing top over all the tradition and individual indigenous knowledge.
Okay. Thank you, Dr. G. We will discuss some other time. Yeah, it is good information for us. Like I can share this video to autism mothers and they will get benefit. Thank you.